Hi everybody, I'm Dr. Roshith. I'm working as Specialist ENT at NMC Medical Center, Ajman. Today I would like to discuss about a very common medical symptom called vertigo. I'm sure many of you may have heard the term before, and most of us experience this symptom at least once in our lifetime. So what we mean by vertigo? Medically, the definition of vertigo is the spinning sensation of one's own surroundings, where he sits, stands or lies. Clinically, there are different types and varieties of vertigo. Broadly, it is classified into central and peripheral vertigo. Before going to the details of that, let me brief you little about the balance system, because vertigo ultimately a disorder of a balance system. Our balance system generally has two major parts, one central part and the other peripheral part. The central part, as you know, it is related to the brain and the central nervous system, and the peripheral parts mainly the four components: the inner ear, our eyes, the muscles and joints, and the nerves. These four peripheral components will carry the signals or inputs from the surroundings, and it is eventually transmitted and processed in our brain. So any disorders or disease of the balance system can make you dizzy. But what is the exact cause of the dizziness, we have to find out first. Generally speaking, among the patients who suffer this vertigo, 80% will have the problem related to the peripheral system, and only 10 to 20% will suffer the problems related to central system. So, which is the most important component in the peripheral system, or which is the component which is affected by the peripheral vertigo? We can undoubtedly say that it is nothing other than ear. So, what is the role of ear in making you study? You know that ear has two functions. One is hearing, and the next most important thing is the balance maintenance. Ear, the deepest part of the ear, that is the inner ear, which is very close to our brain, is helping the brain to give an orientation about the surroundings. Just for briefing the inner ear anatomy simply, we can say that both ear has three semicircular canals which are oriented perpendicular to each other in plane. Within the canal, there is a fluid which moves according to the movement of the head. Suppose if I turn my head to one side, there will be the movement of the fluid in the right ear and the left ear in a particular direction, and which will help the generation of a nervous impulse, and that is transmitted from the ear to the brain. At the time, the brain has an idea that, oh, the head turns to the side or the head turns to opposite side. So this is just an orientation support from the ear to the brain happens. Any disorder which affects in the formation and transmission of this nerve impulse from the inner ear can make you dizzy, for which we call in common man terms are ear balance disorder. Actually, the exact medical term for this ear balance disorder is benign paroxysmal positional vertigo, which means the vertigo which happens according to the abrupt movements of your head. For explaining the pathology of BPPV, let me bring you back again once more to the anatomy of ear. You remember the semicircular canal I told you, which contains a fluid already. Along the walls of the semicircular canal, there is a deposition of calcium carbonates. In some people, this calcium carbonate may dislodge and it may float in the fluid. So when the head moves to one side, along with the movement of this fluid, the calcium carbonate also will move, which will generate an abnormal impulse. This abnormal impulse will be transmitted along with the normal impulse that make the brain confused. This confusion people will feel as vertigo. If you go to ENT doctor with this vertigo symptoms, doctor will perform a test called positional test for this type of positional vertigos. Based on this positional test, we'll have an idea about from which ear and which canal this vertigo arises. According to this, the management plans are made. Management methods involves the medications and some exercises called vestibular exercises, which is actually for the rehabilitation of this problem, and also patient has to undergo some lifestyle modifications. The most important thing is, if you experience a vertigo, never try to self-treat the symptom, because vertigo is not a diagnosis, it's just a symptom. The proper root and proper cause is most important in the management of this problem. If you self-treat the problem, if the underlying pathology still remains within you, it can end up in a trouble, because you can experience sometimes it can recur the problem at the most the unexpected moment in your life. Hope this video helped you. Thanks for watching, and in next video we will come with another common topic. Stay healthy.